Hi all, welcome to my YouTube channel Future Midwife. After my abortion video, few of the nursing students they send me a personal message that they need to take types of abortion detailing. So considering their request, I just plan to continue with the missed abortion today. After seeing their message, really I am so happy. That means there are few students, they are watching my video regularly. Even though they are watching my videos, but still I have less subscribers. So while watching videos, you can subscribe and support me. Your encouragement will be a great support for me to continue with this YouTube channel. Apart from that, if you have any suggestion like that, any particular topic, you can message me. So I will consider that topic first. So along with that, we will continue all the nursing topics according to the nursing syllabus also. So today we will start with the missed abortion. According to Naina Faskar, abortion is the premature expulsion of the conception product from the uterus. It can be either spontaneous or induced. When I took the abortion class, I explained the types of abortions detailing. So in that, abortion can be classified into two ways, mainly like a spontaneous and induced. So again, the spontaneous abortion can be divided into two ways, like isolated and recurrent. So the missed abortion will comes in the isolated spontaneous abortion. Do you know how the missed abortion is different from other types of abortions? Here the embryo is died already inside the uterus, but it is still retained in the uterus. Amenorrhea will be continued, but the mother doesn't know whether she had abortion. So most of the missed abortions, there will not be any sign and symptoms which the mother cannot be identified. So in this condition, the ultrasound only can be helpful for detecting whether the embryo is viable or not. So when we do the ultrasound, there is no fetal heart rate. So from the ultrasound, we can diagnose it is missed abortion. Apart from that, the placenta also will be producing the pregnancy hormone. So when we check the blood test, it indicates the mother is still pregnant. When we consider the missed abortion, the statistics shows mostly the missed abortions will be taking place in the first trimester, exactly in between 4 to 8 weeks of gestation. When it comes to the etiology of the missed abortion, it can be divided into two, maternal factors and fetal factors. So we will see one by one. In the maternal factors, first one is genetics. So 50% of early miscarriage is due to chromosomal abnormalities like trisomy, polyploidy and monosomy. Structural defect like translocation, deletion and inversion. Multiple pregnancies, degeneration of the villi. These are the fetal factors. When it comes to the maternal factors, first one is endocrine and metabolic factors. Usually 10 to 15% of cases will be occurs due to this endocrine and metabolic factors. These metabolic factors are luteal phase defect, thyroid hormone abnormalities, diabetes mellitus, etc. Another 10 to 15% of cases will be due to anatomical abnormalities such as cervico-uterine factors, which include cervical incompetence and insufficiency, congenital malformation of the uterus, uterine fibroid, and intrauterine adhesion. The 5% of missed abortion will be due to infections like virus, parasitic and bacterial. When it comes to the viral, rubella, cytomegalovirus and HIV will be causing missed abortion. When it comes to the parasitic, toxoplasmosis and malaria will be the cause. In case of bacterial, uroplasma and chlamydia. Another 5 to 10% of causes will be immunological disorder like autoimmune disease and anti-fetal antibodies. There are environmental factors also like cigarette smoking, alcohol consumption, contraceptive agents. These will be lead to missed abortion. So here there are some maternal medical illness also can lead to missed abortion like cyanotic heart disease and hemoglobinopathies. But there are 40 to 60% of cases will be unexplained. So in majority the exact cause is not unknown. Here I will explain the clinical features of missed abortion. So as I said you before, there is no typical symptoms which indicative of a missed abortion. The pregnant mother doesn't know whether she had already the missed abortion. Very few cases they will present to the clinic with a dark brown vaginal discharge. So apart from that, there are few clinical features which indicative of clinical missed abortion. These are uterus will be smaller in size. The cervix will be firm and internal os will be closed. Along with that, the pregnancy symptoms which will be reduced, such as morning sickness will be reduced, heartburn will be reduced. If she had a previously like constipation, it will not be there. So like that, the typical symptoms will be reduced if she had already missed abortions. So when she do the ultrasound, there will not be a fetal heart sound. The fetal heart sound will not be audible while doing Doppler ultrasound also. The immunological test of pregnancy will be negative. So these are the some typical symptoms or clinical features which can elicit the mother had already a missed abortion. There are few risk factors also. These risk factors can lead to missed abortions. These are being an older parent, obesity, diabetes mellitus, thyroid disorders. There are some recurrent exposure to radiations and chemicals can also be lead to missed abortions. There are few bad habits like consumption of alcohol and smoking can lead to missed abortion. So these are the some risk factors which can lead to missed abortion. When it comes to the diagnostic aspect, we can diagnose missed abortion with the help of ultrasonography. So I explained just before, like when we do the ultrasonography, especially the Doppler ultrasonography, we cannot audible the fetal heart rate. Other features will be same as pregnancy, like a sac will be there, fetal pole will be there, but there will not be any fetal heart rate. So this ultrasonography will be the ultimate way to diagnose the missed abortion. So apart from that, when we do the immunological test, which I said you before, like HCG, when we repeat the HCG in the alternative days, so the HCG level will be reduced. So that also will be an indication for the missed abortion. When it comes to the management of missed abortion, usually we give time for the spontaneous expulsion of the conceptual product. So after a particular duration of time, if it is not expelled by itself, we will plan to the medical or surgical management. So this management can be planned according to the gestational weeks. So there are two categories. If the gestational weeks is below 12 weeks, the management will be different way, and if it is more than 12 weeks, there will be a little bit different in the management. So we will see in detail. If the uterus is less than 12 weeks, we can use prostaglandin E1. Misoprostol 800 mg is given vaginally and repeated after 24 hours if needed. Expulsion usually occurs within 48 hours. Suction evacuation is done when the medical method fails. If the uterus is more than 12 weeks, 6th or 12th hourly misoprostol tablet given vaginally. If this fail, extra amniotic instillation of ethacrydin lactate also giving. Along with that, antibiotic also giving in order to prevent the further infections. If the uterine product is not expelled with the medical management, we can go for surgical management. So usually we have two surgical management, which is called dilatation and evacuation and dilatation and curettage. So any one method we can use. If the cervix is not dilated after misoprostol, we can go for dilatation and evacuation. So that means manually we have to dilate the uterus, then we have to evacuate the uterine product. Here we reach the complication aspect. There are few complications also after missed abortion. If missed abortion happened early and still it is retained in the uterus, it can be lead to sepsis. Then there will be uterine infections. Then there will be uterine hemorrhage. Very rare cases, some women can develop DIC, that means disseminated intravascular coagulopathy. Usually this will happen if the gestation age is more than 16 weeks. So if the mother develop miscarriage like missed abortion, there is a chances of occurring repeated miscarriage. In some case, the uterine product will not be expelled completely after the usage of misoprostol. So incomplete abortion also will be the complication of missed abortion. Another important complication is Asherman syndrome. Do you know what you mean by Asherman syndrome? If you do repeatedly the dilatation and curettage, the endometrial tissue will be disturbed. So if there is a continuous disturbances of endometrial tissue, it can lead to adhesion formation inside the uterus. So that condition we call it as Asherman's syndromes. So these are the few complications of missed abortions. So the nursing intervention and prevention will be displayed on the slide. Please have a look. I think this is enough for the explanation of missed abortion. So we can wind up our today's section. So once again, I am requesting you, if you have any suggestion related to any topic in the midwifery, you can send personal message. So I will consider that topic first. So in the next time, we will meet with another topic of midwifery. Till that, take care. Bye bye.